The article that I chose to discuss today is it's a experiment using the canine parvovirus monoclonal antibody injection, which is a one-time intravenous injection that treats canine parvovirus. It is a synthetic antibody that mimics the dog's own antibodies to bind to and neutralize the virus before it can enter the cell. And then in this experiment, what they did is they randomly assigned dogs to experimental group, control group, and then they pretty much gave them the parvovirus via an intranasal injection, and then on day 4 the parvovirus was detected in their feces. Pretty much what they were observing for they were observed twice daily for 14 days, and they were looking for appetite, activity level, frequency of vomiting, and then they were also making note of their fecal consistency. And then, so what they found was that on day 4, when they all snapped positive, it kind of coincided with the emergence of the clinical disease signs. And then they started the treatment on day 4, and they noticed already that the dogs that were in the control group, so that did not receive the injection, developed extremely high fevers, had watery diarrhea that had blood or mucus present, moderate to severe vomiting, lethargy, and impotence, and most of the dogs did end up being humanely euthanized. However, all of the 21 dogs that were treated survived, and I think that that's pretty, significant, considering that the parvovirus is such a deadly disease, and so this injection is one of the first of its kind for this virus, so it's still in a bunch of discussion. People are still doing research on it. There are questions about whether or not this is going to have an effect on them having active immunity against canine parvovirus versus just treating. One of the weaknesses discussed is that, this was a relatively small sample size. And, so it would be, interesting to see what happens the more that this drug is used. I know one of the downsides of it is the fact that it is pretty expensive. So, the more cases that we can treat, we'll get more information, and hopefully we can continue to find ways to treat parvovirus and help out our community a little bit that way.